So joining us today is Dr. Alison Chiu, who's an ophthalmologist and one of our experts in diabetic eyes. So Dr. Chiu, I don't know huge amounts about diabetic retinopathy, but I do understand that obviously a diabetic can get it. But what is diabetic retinopathy?
So basically diabetic retinopathy is when diabetes obviously is a systemic disease. It affects the blood vessels primarily. And it's just when the blood vessels at the back of the eye are affected by the disease process.
Okay, and my understanding is that it can lead obviously to visual impairment and potentially blindness.
Absolutely.
How often should patients who have either type 1 or type 2 diabetes be getting their eyes checked by an eye doctor?
So patients with type 2 diabetes, as you know, often have had diabetes for a while before they're diagnosed.
Yep.
So they should have an eye check at diagnosis.
Yes.
If there's no diabetic retinopathy, then the current recommendation is to have regular screening every 2 years.
Mm-hmm.
Yeah. Now, for a patient with type 1 diabetes, then it would be sort of prudent to do their first diabetic eye check a few years after diagnosis. Yeah, depending on their control. If their control is good. If their control is brittle or unstable, then an earlier check would be recommended.
Okay, and what sort of things, when you say an eye check, what does that actually mean?
So that means a vision check.
Yeah, so you're just checking to see if they can see the stuff first.
That's right, and
yeah,
an examination of the eye at the slit lamp. First of all, looking at the anterior segment of the eye, and then drops go into the eye to dilate the pupil, because primarily diabetic eye disease involves the retina, as you said, diabetic retinopathy.
The back of the eye.
That's right.
Yeah. If they get drops put in the eye, is there any instructions in terms of can you drive immediately afterwards or no?
So we use the short-acting drops, but they do last 3 to 4 hours. So I usually tell people that their vision will be blurry for that period of time, and leading up to the appointment, we make a call to say make sure somebody drives you.
Okay, cool. I know that we see a lot of diabetic eye at E4 Eye Clinic, but if they did have a diabetic retinopathy, well, what do you do? How do you treat it?
So it depends on what grade of retinopathy.
Yep.
Basically, the two indications for treatment are whether or not the macula is affected in terms of whether there's an accumulation of fluid, so macular edema, and the other indication for treatment is whether new vessels are developing in the retina. So that's proliferative diabetic retinopathy. So we divide diabetic retinopathy into sort of background changes, non-proliferative diabetic retinopathy. And those changes are classified as mild, moderate or severe. And then there's proliferative diabetic retinopathy. Across those categories, diabetic macular edema can occur in any of those cases.
Awesome. So that's Dr. Alison Chiu talking about diabetic retinopathy. If you have diabetes or know someone that has got diabetes and you require a diabetic eye check, the E4 Eye Clinic will happily see patients. Our doctors are bulk billing. You can make an appointment via our online health engine system or by calling 1300 E4 Health. Thank you, Dr. Alison Chiu.
Thank you, Dr. Susie.